I understand that you're interested in allergy diagnostics and immunotherapy. I'm Dr. Fred Pullen, clinical professor in the Department of Otolaryngology at the Miller School of Medicine at the University of Miami. I've been practicing otolaryngologic allergy in my office for over 30 years. Why is an update on allergies important to you? First and foremost, 1 in 5 Americans, or 20% of the American population, has some form of allergy. The number one is allergic rhinitis, in which 40% of the American people have some type of allergy in the nose. There's also a huge number of deaths that occur due to anaphylactic reactions, such as to peanuts. And it is the 5th leading cause of chronic disease, according to Medicare. The healthcare costs are in the billions. $3 to $5 billion a year are spent on medication as well as drugs and doctor appointments. Allergies are becoming much more common, but why? First, there's an increase in allergen exposure. There's high level of pollutants in the atmosphere. There's an increased exposure to food additives and genetically modified foods. There is a genetic susceptibility which has been increasing over the last 40 years, according to published reports. There's a decrease in immune system stimulation, which is the hygiene hypothesis, saying that we have been using antibiotics for a long time and therefore we're not exposed to as many bacteria as we used to be, which also help with the immune system. And of course, the biodiversity hypothesis, which says in cities these days, we don't have the same amount of green or other diversity in our biosystems. And allergies are much more common in developed countries. There's a critical shortage of allergists. This is an important point, and that is that who's going to manage allergic diseases? Allergic diseases at the present time are managed with approximately 3,000 to 4,000 allergists in the United States. In the future, there's going to be many more patients with allergies that need to be managed, and those physicians who are allergists are not going to be able to do this. The crisis adds a burden to primary care physicians who are going to have to handle the patients with allergies in the future. The typical allergic presentations include allergic rhinitis, rhinosinusitis, allergic conjunctivitis, urticaria, atopic eczema, contact dermatitis, asthma, and certain GI disorders, as well as anaphylaxis. Common allergic triggers are pollens, animal dander, dust mites, cockroaches, which are incriminated in allergic asthma, insect bites, foods, and fragrance. In fact, the other day in my office, a woman came in and had an allergic attack due to the perfume that was on one of our employees. Patients are also allergic to latex, medications, and chemicals. Patients appropriate for allergy testing it's very important to know. The patients complaining of persistent upper respiratory infections and symptoms. Those who chronically use antihistamines with or without success. And pediatric patients with stubborn rashes, eczema, chronic ear infections, or GI symptoms. We had patients who had chronic ear infections that were sent to our office for tubes in the ears, and we found that 75% of them didn't need tubes if we stopped the milk and milk products. Patients with unexplained symptoms who are exposed to typical allergens. There are 2 types of allergy testing. One is skin testing, which can be done in the office and is easy, and serological testings that can be done by most laboratories. The advantages of skin testing. The percutaneous skin test is much more accurate. It detects the presence of immune globulin E mediated sensitization. The advantages of skin testing are very simple: minimally invasive, good reproducibility, easily quantified, and allows for the evaluation of multiple antigens at the same time. And the results correlate with real-life allergen challenges. Skin testing alone or in combination with in vitro testing is the most accurate technique. The technician can perform the skin tests in the office, and the clinician must be aware of the pros and cons, such as which devices are used to apply the antigens, what the location of the tests on the body, such as the arm or the back, the type of extracts used, and the potential for suppression by concomitant medication. Skin tests are measured by the size of a wheal that is produced in the skin. A positive if a wheal is 3 to 4 millimeters compared to the negative control, or 10 millimeters or more of surrounding flare reaction, measured on a small rule which is given to the physicians. The typical panel of allergens for skin testing are foods, pollens, grasses, plants, trees, molds, and even cat and dog dander. Why skin testing is important to patients with allergy? Because the sensitivity is higher than 90%. The skin tests are more sensitive than laboratory blood tests, and there's a lower false negative rate. It can be performed on infants as young as 1 month old. However, we prefer not to do it under the age of 4, but it can be. The safety profile is well established. It's extremely rare adverse reactions, and in my office there's been no near fatal or life-threatening episodes ever. It is significantly greater incidence of adverse reactions during a routine venipuncture such as syncope. Who should not be tested? Pregnant women should not be tested. Asthmatics with severe symptoms should not be tested. Asthmatics with poor lung function on the day of testing. Patients who have had an anaphylactic reaction to types of allergens to be tested, such as peanuts or cat, dog, or anything that they've had some sort of reaction in the past. Patients who have generalized skin diseases, such as eczema or dermatographia, and patients who are on medications that influence skin wheals, such as antihistamines, steroids, and antidepressants. In these circumstances, you can always advise a blood test for a specific IgE. The overall management of allergic conditions: first and foremost, environmental control measures and allergen avoidance. This is more important than anything. For example, cat and dog. If a cat is the cause of the allergy, then the cat should be avoided. Patient education is important as to what they should avoid and what they are allergic to. And then, of course, the next treatment is pharmacological with antihistamines, decongestants, corticosteroids, which can be intranasal, topical, or oral. And then lastly, immunotherapy. Immunotherapy for allergic conditions is a long-term treatment. It decreases symptoms such as allergic rhinitis, conjunctivitis, allergic asthma, and atopic dermatitis. It decreases the sensitivity to allergens, and it leads to long-lasting relief of allergic symptoms, and it's cost-effective for the patient. Patients who have long-term allergies will develop an immunity to that allergen, and eventually after treatment will be able to avoid this in any symptoms. Factors for success. Number one is patient selection. You have to know what they're allergic to and whether or not they're willing to continue with the allergy treatment. The allergen selection comes from a positive skin test or from the immune globulin test done in the laboratory. The target dose as to how much antigen should be utilized for the individual, and then of course the dosing frequency. Should they get injections or sublingual drops daily, or the injections once a week or twice a week? Most important is compliance, and the compliance of the patient is more important than anything. If they are going to stop after a week or two or after a month or two, this will not help them. And the expectation of out-of-pocket patient costs should be explained to the individual patient so that they can know whether or not they can afford to take the time to become compliant. The summary of benefits. In other words, a patient will understand the cause of his allergic suffering. The decrease in symptoms with treating the cause, and a decrease in the use of medication with treating the cause. The long-term effectiveness of immunotherapy should be explained to the patient so that they understand the entire program. And it is a preventive treatment. Asthmatics, emergency room visits, and kids developing asthma with a storm of increasing allergy as they get older. Immunotherapy is the only treatment that influences the basic course of allergic disease and can be done in the office very easily. Implementing allergy treatment and immunotherapy. How do you get started? Just click the link at the bottom of this video presentation for more information.